Is there a wide range of brain damage, and how severe is each type of damage? Every single traumatic brain injury is classified as a head injury. It is not always the case that a head injury is also a brain injury. Traumatic brain injuries and acquired brain injuries are the two categories of people who can sustain a brain injury. The regular functioning of the brain is both affected by both. The term traumatic brain injury, TBI, refers to an injury that occurs when the brain is moved inside the skull or when the skull itself is damaged as a result of an external force, such as by being struck on the head. The brain suffers as a consequence of this. An acquired brain injury, also known as an ABI, takes place at the cellular level. Pressure exerted on the brain is the most common phenomenon connected with it. It's possible that a tumor is the cause. There is also the possibility that it is the consequence of a neurological condition, such as a stroke. When the brain is deprived of oxygen for an extended period of time, there is a possibility that damage will occur to the brain. A wide variety of traumas, illnesses, or disorders can all lead to brain damage. Brain damage can be caused by any of them. Those boys between the ages of 15 and 24 who engage in high-risk behaviors are the most susceptible to infection. In addition, it is more likely to occur in younger children and elderly people. What are some of the causes of traumatic brain injuries? Automobile collisions occurred, hits to the head by blows, accidents that occur in sports, accidental falls or falls, the use of physical force. What are some of the causes of acquired brain injury? The ingestion of poisonous substances or exposure to them, an infection, the act of strangulation, choking, or drowning, a stroke, a heart attack occurs. There are tumors, the term aneurysms, neurological diseases, misuse of medications that are unlawful, brain damage, whether it was caused by a traumatic event or acquired, can manifest itself in a variety of ways. In general, they can be divided into 4 categories: contemplative, perceptual in nature, for the body, psychological and behavioral. These are some of the cognitive symptoms of brain damage: the inability to comprehend information effectively, having trouble articulating one's thoughts, having trouble comprehending other people, attention span that is shorter, an inability to comprehend abstract ideas and concepts, capacity for making decisions that is impaired, a loss of memory occurring. It is possible to perceive the following signs of brain damage: a shift in one's eyesight, hearing, or sensation of touch, an inability to locate your whereabouts, the inability to perceive the passage of time. Smell and taste disorders are a common occurrence. There are problems with balance, sensitivity to pain that is increased. These are some of the physical symptoms of brain damage. Headaches that are persistent. The mental exhaustion is extreme. The physical exhaustion is extreme. Inability to move. Failing to be strong. There are tremors. Seizures are seizures. Light sensitivity is a trait. Disorders of sleep that occur. Speech that is slurred. Consciousness comes and goes. These are some examples of behavioral and emotional indicators of brain damage. Impatience and irritability are present, lowered capacity to deal with stress, a lack of energy, feelings or reactions that have been minimized or amplified. It is a denial of incapacity, aggressiveness that has increased. What kind of treatment are available for brain injuries and damage? In the event that a person sustains a head or brain damage, they require emergency medical assistance. It is possible for a brain injury that appears to be relatively minor, known as a concussion, to be just as hazardous as injuries that are obviously serious. Both the extent of the damage and its placement are important considerations. A brain injury may not necessarily result in a handicap or impairment that lasts for a long period of time. However, in order to restrict or reduce the extent of the damage, the appropriate diagnosis and therapy are required. Examining the patient's neurological system, performing neuroimaging tests like MRI or CT scans, and conducting neuropsychological evaluations are the methods that are used to identify the amount and impact of brain damage. Controlling the patient's blood pressure and ensuring that blood and oxygen are flowing to the brain in the appropriate manner are all things that the doctors will do in order to stabilize the patient and prevent additional injury. Rehabilitation is something that almost all patients will benefit from in order to assist in their long-term recovery. This may involve the following: the treatment of physical ailments, the practice of occupational therapy, speech and language therapy, offers psychological assistance. Like, share, comment, and subscribe for more videos.